one of the diseases in the digestive system, the autoimmune diseases, is, in my opinion, coming more and more morbus Crohn.
Yes, it's becoming more and more common.
Yes.
Yes.
And it's an inflammation on the small intestines, but also in the colon.
Yes.
And it creates a lot of trouble. So cramps a lot. You have diarrhea quite often, and also blood and mucus is in the stool, and tiredness, weakness, and it's really a very severe disease.
And chronic disease.
Chronic disease.
Very chronic.
And
I remember you had a patient who I saw.
Yes, I
was treated on
Yes.
Ayushakti's treatment and diet plan that you gave to her.
Yes, and this patient, it's a woman around in her 30s. She has already a long time morbus Crohn.
Yes.
And she was several times in the hospital, and they recommend her to do an operation.
To remove the part which is inflamed in the small intestine and make it shorter.
Yes, yes.
Yeah.
And so for this reason, she said, I would like to try an alternative therapy.
In anyways, even after surgery, it comes back after 5 years, I think.
Yes,
so
of course, in another place.
There is no in another place, so it is better always to treat from inside.
Yes.
Yeah.
And so she started in our practice with the diet explanation. She got a very strict diet, and also she was on Panchkarma. And there was another problem. She couldn't get pregnant because of the morbus Crohn. And you said it is written in Ayurveda that there is a problem in getting pregnant
as well, yeah.
Oh, okay. So she was on a high doses of steroid, and slowly we could reduce it.
Wow.
And with the examination in the hospital as well. So at the end, she had no steroid.
Completely stopped the steroids?
Yes, and still stayed on the diet, on the herbs.
In the herbs, yeah.
And not long ago she came and she was so happy because she was pregnant. And the examination showed she was out of Crohn.
So she was no more Crohn, it was negative for Crohn's disease.
It was negative.
Wow, this is fantastic. This is amazing result.
Yes.
So I know that I met this patient and I know from Ayurveda, working with this for 27 years, that in the Crohn's disease there is a fantastic result. It is important that they do it for long term, steadily and continuously for at least 3 to 5 years.
Yes.
I have known people around the world coming from Australia, New Zealand, USA, and also now in India, that people who do it for 3 to 5 years, once they get out of it, it doesn't come back for almost 15 years. I have noticed it doesn't come back.
Yes.
So that is very good.
I think they are a candidate for morbus Crohn, but if they are taking care of themselves, it can be stopped and there are no symptoms.
There are many people who are not diagnosed as morbus Crohn's or IBS, because even IBS has similar symptoms like Crohn's disease, you know. You can call, they are like mixed up. IBS is a symptom. So for them, you know, I want to again describe the symptom, because if you are feeling in the morning that you have to go 4, 5, 6 times to the toilet and still it's not clear, and many people, their whole morning 2-3 hours is completely lost only in managing the situation of clearing the stool, you know. They don't feel it is emptied, and that's why they can't go to their work in time. It takes long time to get ready. So that's kind of a IBS or Crohn's kind of a symptoms. Sometimes they get also diarrhea, loose stools. Sometimes they are very constipated. And there is always with particular food, especially carbohydrates, when they take it, they feel bloated and cramp or sometimes pain, and sometimes people have constant pain happening in the stomach ongoing, you know, because we all in any form we take carbohydrate. So wheat or spelt or rye, any kinds of carbohydrate will always produce trouble. Especially high fiber food produces big trouble in Crohn's disease and also in IBS, because it's so complicated, because for constipation you want to take high fiber food. Moment you take high fiber food, there is diarrhea and there is this a typical pain happening and bloated and everything. So the life is, for these people really, they are so afraid that they stop eating practically everything, and finally they become undernourished, pale, very weak, lose lot of weight, and nervous as well, because nervous system when it is not nourished, it's very always very tender, and they feel nervous, anxious, fearful also in their mental things. So it is important in this situation that they should stop all the high fiber food, like all the grains and cereals which are very high fiber, wheat, oats, spelt, rye, all these things, partly kamut as well. And take all the cereals which are slightly less fibrous, like rice or whole rice. Moong bean is very good. Sometimes if they feel gas, then yellow dal is very good. Then they will not feel gas with yellow dal. Yellow lentils are okay. Little bit of orange lentil is fine as well. Lots of pumpkin and squash family vegetables. I always recommend people to take, in the Western world, zucchini, pumpkin, all different paddy pan. These are different kinds of vegetables from the squash family. In India, specifically what we call is lauki and turai, ridge gourd, bitter gourd, different kinds of gourds which are soft from inside. These are and hard from outside. And when we cook, they are very soft. So these kind of vegetables, they heal the inflammatory process over long time. If you take them every day cooked, I know that a lot of people came out of the Crohn's disease after 2 to 3 years of this kind of a diet.
No raw food.
No raw food.
No raw vegetables, salad.
No raw food, no raw fruits as well, because it ferments and produces gas and pain. They are very sensitive. Some people are even sensitive with the milk products. So like milk directly, sometimes cheese, this is not good. Many things like alcohol, wine, or coffee, tea, all the aerated soda kind of drinks, these are also creating gas and pain in the stomach, so it should be avoided if possible completely. And slowly with this and certain specific kind of herbs which reduces inflammation, like ampachak and ojas, which is working on the immune system, D-Viro, which is also working on the immune system, and plus something that reduces acidity, like antacid natural things, licorice or shatavari. These are the things which really heal our system very deeply. And slowly, as you said, with this German lady and many more people I have seen, Crohn's disease actually can be treated very well, and the symptoms can be completely controlled. And in this case, she even had a hospital report that she is negative for Crohn's disease, which is fantastic. So that's possible with a long-term constant efforts for 3 to 5 years.
Yes, and my experience is for these patients, they are suffering so much that they have the discipline to follow this diet, which is very important. It's the base of it.
They are so tired that they are feeling, oh, my life is restricted. But how long will I do? But believe me, if you do it for long term, steadily for 3 to 5 years, after that, once you are out of it, if you don't follow too strictly also, you don't suffer. That's what I have seen.
Yeah.